I have 2 children, and the state has labeled them with, well, right now it's not developmentally delayed, but they have labeled them with emotional handicaps, and I've made it perfectly clear that medication is not an option. Behavior modification is. Learned behaviors, you know. A lot of these children have these problems because of it could be a birth defect. It could be from traumatic issues that arose in the family, a divorce. You know, a lot of these things that happen throughout a child's lifetime has an impact on their behavior. And the answer is not always for medication. The answer pretty much is behavior modification.
Is that what you're doing? Okay, we have a panel here of they're all in town for an international conference here on alternatives to medicating children, and we were just discussing that there was a woman there going out to commercial break who said, you know, that she's had this experience and that she feels like behavior modification is a better answer than giving kids medication. You were saying during the break there is an issue with kids who have been taken away from their homes. They're in foster care. You know, they have, we are seeing high rates of all these psychiatric disorders in these children in foster care. What were you saying about that?
Well, I was saying that in Florida particularly, more than 80% of the children under foster care or under state care are being medicated with potent medications usually reserved for psychosis or very intense disorders.
With what diagnosis? What do they
well,
say?
They give the diagnosis du jour is bipolar, and it's never been assigned to children, the diagnosis of bipolar. In 40 years of practice, you never saw even one child diagnosed bipolar. Now, since the onset of SSRIs or antidepressants, what's happening is you're getting manic episodes which are induced as a side effect of the antidepressants. So you're beginning to see mania. But the reason they've developed at Harvard with Biederman and some of the other psychiatrists there, the idea of bipolar in children is because they can justify medicating the children with 4 or 5 drugs and make even more money for the drug companies.
Is it not possible that 20 years ago, doctors and psychiatrists and psychologists weren't educated to recognize that this is actual depression, this is bipolar, this is anxiety, and we had kids committing suicide from having depression? Are you saying that we aren't better at diagnosing these things now?
Well, actually, suicide is increased, and our diagnosis is worse because people do a diagnosis in 15 minutes and then decide to give a child a very toxic drug. In fact, if you study the diagnosis of bipolar, in fact, you need a recurrent manic-depressive sequence or depressive-depressive or manic-manic sequence over time to justify the diagnosis of manic-depressive or bipolar. If you have a child and all of a sudden he looks depressed, you can't call him bipolar.
You know, I saw an interesting segment on a channel recently, a medical channel, where a child was being evaluated for, does this child have ADD or ADHD, and is medication going to help? And they had brain scans, they had EEGs, they had neurologists, they had all this stuff. You know, most parents don't have the knowledge of where to take their child if their child is having problems, nor would they probably have the money for this sort of extensive evaluation of whether a child has a psychiatric issue or not and whether medication is required. They just go to their family doctor and they get something.
The extensive evaluations don't help. They're always being done by people who are deeply invested in making a diagnosis and giving the drugs. So getting better as a psychiatrist, I can tell you the most dangerous thing you can do today is take your child to a psychiatrist, because all the
you're killing your own profession.
all
what are you saying?
Well, all my colleagues know is giving drugs. That's how they make their living now. So it's like if you got just a hammer, you hit everything with a hammer. That's all they have is the hammer of drugs. And our kids deserve so much more than that. And what they really deserve is more of us. I mean, that's what we seem unwilling to do, to give them more schooling, better schooling, smaller classes, teachers who are more involved in caring and have the time and the energy to do the work. Parents who are going to raise their kids instead of giving them to somebody else to raise. Parents who are going to learn how to raise their kids.
Talk about the trend toward giving adult drugs or drugs designed for adults to children, and what we don't know about what the child's brain is still developing. What is the long-term consequence of doing this, in your opinion?
Well, mostly what was done in the past was giving these kids who were attention deficit disorder, hyperactivity, all these kinds of diagnoses. They were given Adderall and these amphetamine-type drugs. Now, and this is for a lot of economic reasons, they're giving more expensive antipsychotic drugs, drugs like Zyprexa, Risperdal. I want to get back to a little bit the whole issue of diagnosing these kids. It has to. There's as this panel's already said, there's no scientific lab test, EEG, blood test. How these kids are diagnosed are through questionnaires. And these questionnaires are, in a scientific sense, very unreliable. What do I mean? If you ask, what happens is these kids are asked, their teachers are asked these questions, and parents are asked, and we found, and if you take a look at the scientific literature, that those teachers or those parents who are getting along better with the kids, those teachers and parents that a kid feels better about, they don't see these kids with these diseases and illnesses. So these kids act very differently with teachers that they get along with, who they think that like them.
Okay, let's go out to break with this email from Deborah in Lakeland. And Deborah says, my son was diagnosed with ADHD. His behavior got bad when his dad died. They wanted to medicate him. I changed his diet, eliminated all caffeine, preservatives, artificial everything. It changed him. Now he's grown in the Navy, married, with 2 kids. Wow, that's quite a story. That says a lot about what our panel is saying today. Appreciate that, Deborah, very much, and I'm glad that you had a good result with your son. Take a break, and we'll be right back.
That is an option more parents should be looking at. However, we live in reality, and reality is hard economic times. Parents are working 2-3 jobs to, support their kids, so they're not really looking at the emotional thing of what's going on with the children, more financial, making sure the kids are taken care of, making sure they have clothes, making sure that they eat. Still, those are your children. Take some time, talk with the parents, have an open communication, open dialogue with the teachers, so that every day what's going on with your child, because the teachers communicate.